The new AHA-ASA 2026 stroke guidelines have some important medication updates that you should know about. What's up, you guys? It's your ER pharmacist, Lil Pharma. Today we are talking about the new 2026 stroke guidelines and what that means in terms of pharmacology. So there's been some important updates in thrombolytic therapy, antiplatelet therapy, and treatment timeframes. So first and most importantly, they've added Tenecteplase to the actual guideline. I know a lot of us have been using Tenecteplase in practice for quite some time now, but it is actually FDA approved in the guidelines. We know it's logistically much easier to use as a single bolus rather than an infusion. So we prefer Tenecteplase. There is some data that indicate it may have better functional outcomes, but similar bleed risk. So Tenecteplase all the way. The next recommendation is the extended treatment time frame. So we had extended it up to 4.5 hours in the 2019 guidelines, but it's now extended even further if you have imaging that shows viable tissue, up to 9 hours for fibrinolytic therapy. That's based off of the Extend trial as well as the Wake Up trial, showing that salvageable tissue is really much more important than actual time. So this is kind of a fundamental practice change where we're shifting from time-based management to tissue-based management, which was always the case, but it's now in the guidelines. And then the third important update that you need to know about is antiplatelet therapy. So antiplatelet therapy with dual antiplatelet therapy is recommended for low-risk strokes or high-risk TIAs, and it's recommended within 72 hours of injury for 21 to 30 days. So those are the three medication updates from the 2026 stroke guidelines. Let me know if you have questions, if you want any clarification on anything. Again, a lot of the stuff we've been doing in practice, but it's great to see it actually in the guidelines. That's what I got for you guys. Bye.